Joining us today at noon, Texas Governor Greg Abbott. Governor Abbott, thanks for joining us. First of all, we hope you and your family are doing well.
Oh, you too and everybody in the Rio Grande Valley. Hope you're safe and have a fabulous Memorial Day weekend.
All right, thanks so much, Governor. Well, today, more businesses like bars, bingo parlors, bowling alleys opening up at 25% capacity. Restaurants can now serve at 50% capacity. The Texas Department of Health Services data shows COVID-19 cases continue to go up every day. So what went into your decision making in going forward with phase 2? And how concerned are you about coronavirus cases increasing?
Sure. Well, let's dig in very briefly into the numbers because the numbers don't continue to go up. In fact, like today, right now, so far, the number of people testing positive is 975, which is down from a few days ago. What does go up, however, is the number of people being tested. And so when you test more people, there will be more people testing positive. The important numbers are these, and that is what's called the positivity rate. That's the percentage of people who are tested who test positive. Those numbers continue to go down. As an example, earlier this month, those numbers were as high as 7, even 8% of the people who were tested positive. Today, the number is half that. About 4% of the people who were tested test positive. But more important than that, in contrast to what you just heard on your own show about Alabama, where they were running out of hospital beds, in Texas, we have plenty of hospital beds. In fact, there are more than 100 people fewer in Texas hospitals today than there were yesterday because of COVID-19. We've never had any challenges with regard to limited hospital capacity, with ventilators, with the ability to treat people who may test positive for COVID-19, and two very important factual numbers, and that is Texas has one of the lowest death rates in the United States, but we have the second highest number of recoveries from COVID-19 of any state in America.
Okay, those are positive signs, but what's the status of testing around the state, and can state labs keep up?
Sure. So testing continues to increase. You may have seen the information that came out just yesterday that we announced that there are now going to be 44 drive-thrus for CVS, and that is going to increase our testing even more. But on top of that, what we are doing through the governor's office as well as the Department of State Health Services is we are going into every nursing home in the state of Texas, testing every resident and every staff member, and then sanitizing those nursing homes. And we're doing the exact same thing for other vulnerable populations, such as state supporting living facilities, because we know these vulnerable populations have a greater propensity to maybe contract COVID-19 and suffer some of the worst consequences. So we are addressing the most vulnerable first, but we're putting a keen emphasis on sanitizing it, cleaning it up, making sure that we eliminate COVID-19 germs from those settings.
All right, I'm glad you mentioned that, because in Cameron County, here in the Valley, about 80% of all the deaths in the county are residents in nursing homes. It's very important, the work that you're doing. So you just mentioned some of the things that the state is doing to help these facilities. Are you giving them the right equipment and all the resources they need to fight this?
Yeah, absolutely. So your observation is exactly what our observation is, and that is most of the deaths in Texas are people who are age 65 and older, especially those living in senior living facilities. And so one way that we are holding down deaths in Texas is we are providing tremendous support to those living in senior living facilities. And one way we do that support is by going in and testing them to make sure that if they test positive, we're able to separate those who test positive from those who are otherwise well, so that it doesn't spread anymore. The other thing is this sanitizing it, cleaning it. We have, in some places, the National Guard going in and completely cleaning out these senior living facilities to make sure that they will not be exposed any further to the germs that could cause them to get ill. But we want to protect our most vulnerable population. We want them to have healthy lives, and we want to reduce the fatality rate in the state of Texas.
Governor, with the easing of restrictions, more and more people are going out, some people choosing not to wear a face mask, even though you strongly encourage it. Why not just make it mandatory to wear a face mask?
Well, so there are certain things that we as a state and the people in this state need to do if we are going to continue to open up businesses. As we open up business, it will mean that more people will be getting out, in part to go to a restaurant, to go to a bar, to go to a grocery store, or engage in some other fun activities. However, everyone needs to understand COVID-19 has not like suddenly disappeared from the state of Texas. It is still here. It is still an infectious disease that can be transmitted from one person to another. As a result, it is essential for everybody in Texas to continue these safe practices of washing your hands, wearing a face mask, keeping your distance from others so that you can prevent transmitting this disease from one person to another. We want to make sure everyone understands what the safe practices are. One thing that we don't want to do, because people feel like their lives are being infringed upon due to no fault of their own, we don't want to be putting people in jail because they refuse to wear a face mask. We just want to emphasize to them that this is the best medical advice, but candidly, it's the best thing that you can do to protect your own safety. We also know that, especially in the Rio Grande Valley, there's so many people who care dearly about their parents and their grandparents, and that you don't want to cause your grandparent to get ill or even lose their life by transmitting COVID-19 to them. And the best way you can protect your grandparent is to make sure that you wear a face mask.
Absolutely. And Governor, what do you tell all of those people? Because we have a lot of people emailing us every day saying they would just feel more comfortable going to places if everyone was wearing a face mask.
You know, you make a keen point there, and the person who sent it in does, because here's what I have observed, and this is what's going to happen. There are a lot of people right now who are apprehensive, or they are afraid about going out to a restaurant, to a bar, whatever the case may be. Here is exactly what we are finding, and that is the stores and restaurants and businesses that open up with safe practices, those are the ones that customers are going to go to. If you find businesses that open up that do not have safe practices, you're going to find so many people refuse to go into those locations. So this is what you call best business practices to maintain the safe practices that will reduce the spread of COVID-19. That is the way to attract customers. These businesses are opening up for a reason. They need customers so they can pay their bills, pay their rent, and begin to earn money again. They will not be able to do that unless they instill confidence in their customers that if the customer goes into that business, they will not be contracting COVID-19.
Moving on, travel restrictions just lifted for people traveling from New York, California, Connecticut, and other larger cities. Why now? And will TSA have some sort of checkpoint at airports for those coming in from these states, like taking their temperature, or will they be given COVID-19 tests before entering the state?
So that type of testing and some other measures were undertaken while the travel restrictions were in place. Now, on the advice of the 4 medical doctors who advise us in our decision-making process, they said that it was no longer needed to have these travel restrictions, and so you'll know what the restrictions were, and that is people coming into Texas from these formerly hot zones and other places across the country. They were subject to a 14-day quarantine before they could go do anything else once they arrived here. What we have learned since those travel restrictions were in place is that those hot zones have been tamped down, and the percentage of the positivity rate from the travel restricted areas is exactly what it is in the state of Texas at this time. And as a result, there's just kind of no mathematical reason for the travel restrictions to remain in place.
You recently announced school districts can hold summer school starting June 1st. What have educators told you about this decision?
Well, listen, there are some, if you would, some mixed approaches to opening up schools in the summertime for several reasons. One is this the right strategy for students? Is it a safe way of going about opening up schools? Understand that what is authorized is that schools can physically open up their campus if they choose to do so, using certain safe distancing standards to make sure it prevents the transmission of COVID-19. However, for schools that do want to provide education over the course of the summertime, they can continue the process of doing it by what we call distance learning. You know, it could be through Zoom or through some other device where people who are teachers can be able to communicate with students via video. So that strategy remains in place. But I'll tell you this. Opening up schools at this time will provide us information to prepare us for the best, safest strategies as we try to open up schools this coming fall for all students at all schools across the state of Texas.
What is the state doing to prevent or prepare for a second surge? We keep hearing about that second wave.
Sure. So we hear about that also, and we prepare for a potential second wave in several ways. One is we continue to add to this PPE. Remember when you used to talk about PPE all the time? A key component of PPE is face masks. And so we are distributing close to 1 million face masks per day right now across the state of Texas. We've created a good pipeline of the number of face masks that we are able to purchase. And so we will soon begin the process of being able to stockpile some of those face masks as well as other PPE for the fall in the event that there is a second wave that arrives. And then the second thing that we do is we constantly work with hospitals and hospital capacity as well as making sure we have adequate number of ventilators so that if there is a second wave, especially at a time when the flu season is arising, we want to make sure that we will have the hospital and medical capability to respond to anybody who tests positive for COVID-19.
Governor, thank you so much for your time. We really appreciate it. And thanks for sharing that important information.
My pleasure, and be safe.
You too. We'll be right back.